Hi folks, welcome to another episode of Dental Tips of the Week with me, Dr. Sherwin from Artistic Dental Studio. As you can see, I'm sitting outdoors and we're really blessed with this nice weather here in Queensland, Australia. And all you know, you know that it is winter here and we're enjoying our outdoors. So let's dive in. What I'm going to talk about today is about the most common mistakes people usually make when dealing with tooth sensitivity. The first thing I want to talk about is that people may think, well, if a tooth is sensitive, it could be dealt with in a particular way. It's true, but not all teeth sensitivities should be dealt with in the same way. So one size fits all doesn't apply here. And I wanted to just divide it into different categories so you know where the sensitivity is coming from and what you need to do about it. First of all, let me tell you, this is very important because it could affect your life directly by, you just avoid drinking your favorite beverages or your foods, or you just need to steer away from something that you really like, or in some extreme cases it could even cause pain during speaking, something this simple, but it could be quite agonizing. So let me begin with the most common sources of tooth sensitivity and how we could control them. First of all, the first thing is gum recession. We all know that teeth are covered with a harder shell, which is called enamel. And this enamel actually ends where the gum begins. So in some cases where the gum recedes for any given reason, we can see that those areas of the root which were previously covered by gum are now bare and exposed to the mouth. And because they're not covered with enamel, they're quite sensitive to any kind of change in temperatures or even something like sweet things. So this is the first reason why you may feel the sensitivity. And how it could be addressed, well, it depends on how severe it is. First of all, we need to control the what has caused this gum recession. And then how we can control it, we can begin with applying some chemicals which could be applied in a dental practice, or you could apply it at home. And these are mostly some desensitizing agents. And the second thing could be covering those areas with a kind of filling, or even like a graft of gum that could easily cover those areas and prevent it from being sensitive. The second thing, hi Tash, thank you for coming in. The second thing is the tooth decay. The tooth decay, actually, we all know that it could cause some sensitivity. As I told you in the previous videos, it could cause some sensitivity to cold and sweets mainly. And we all know that we need to get those cavities fixed. So it's something quite straightforward. The third thing, which is very important, is the grinding and clenching. Actually, what it causes is that with both grinding and clenching, that superficial layer of enamel is lost. So the underlying tooth material, which is called dentin, is exposed, and dentin is full of nerve endings. So it begins the sensitivity process. And if you want to compare the enamel with the dentin, you can compare just like stainless steel with chalk. You can see how these two could compare, and enamel and dentin are exactly like that. So dentin is much softer and is a live tissue. So it begins to react to all the stimulants. And another thing that grinding and clenching could cause is that when someone does this grinding, the forces are concentrated on a limited number of teeth normally. And these teeth, because they are overloaded, the nerves inside begin to fire up an inflammatory process and become sensitive to even normal fluctuations of temperature in mouth. The fourth thing I wanted to talk about is the tooth cracks. So tooth crack could easily cause sensitivity because there is an opening and everything could go down inside the tooth and cause sensitivity to flare up. And the treatment is quite obvious. We need to fix the crack somehow with fillings or crowns. The next one is the erosion. Erosion is the chemical action of any acids on the top of the tooth and dissolving the enamel. It could cause because by something like acidic foods or fibrous foods, anything like that, or in patients with problems with the stomach, heartburn, with the stomach acid comes into the mouth and causes this dissolution. And so seeing your GP or possibly fixing the teeth, covering the teeth with some form of crown or veneer or filling could help. And the last one is dental procedures. Some dental procedures could cause some transient sensitivity, like even very, very simple cleaning, a whitening procedure, or even if you have been to a dentist recently and you feel some sensitivity immediately after the procedure. It could be because of a minor high spot on that filling or a crown, which could initiate that response. And you need to get back to your dentist and they can investigate and see where it's coming from. And by just a little bit of like polishing or something like that, everything will be fine. So these are the most common causes of sensitivity. And as you can see, they are quite different. The origins are different, and so the solutions are different too. Thank you very much for your attention. I just need you to put your comments down here and also ask your questions, share this video, and also tune in, give us some thumbs up, and wait for the next video next week, which will be about crooked smiles. I want to share the experience with one of my patients and how we could help her achieve her goals, and that was a total game changer for her. Thank you very much, and see you next week. Enjoy the rest of your day.